So good morning, everybody, and thank you so much for joining us here today. My name is Fiona Dalton. I'm the President and Chief Executive Officer of Providence Healthcare. I'm honoured to be your MC for this virtual event to commemorate World AIDS Day. I'm joining you here today from the traditional and unceded territory of the Musqueam, the Tsleil-Waututh and the Squamish peoples, and it's an honour to be here on this land. I wanted to say thank you very much to Dr. Julio Montana, BC Centre for Excellence in HIV/AIDS, and of course Minister Adrian for being part of this special day. Both the Minister and Dr. Montana are going to speak, and then we will provide time for questions at the end of their presentations. Please you could raise your hand in the Zoom chat, and we'll answer questions related to today's announcement first, followed by other questions if we have time. The Zoom meeting is being recorded, and the recording will be available upon request shortly after we've done here today. And so it's now my privilege to hand over to the Honourable Adrian, Minister of Health. Thank you very much, Minister Dix.
Thank you very much, Fiona. Thank you to everybody at the BC Centre for Excellence for HIV/AIDS, which has, of course, done extraordinary things over the last decades. Now it's hard to imagine that that's what it's been, but it has been decades. And thank you to the whole community who supports both the recognition of World AIDS Day and people living with HIV/AIDS, who represent a whole generation of people who have advocated and fought and led. And that includes Dr. Montagnier and his team, of course, includes people at Providence and Vancouver Coastal Health and Fraser Health and all over BC. But it also includes a generation of people who've worked in the community to bring change and provided the impetus for the extraordinary work that Dr. Montagnier, amongst others, has led. And so I want to salute everybody today and say that I'm doing that here on the territory of the Lekwungen-speaking people, the Sanghees and the Esquimalt First Nations. I'm joining you from my office in Victoria. I wanted to talk about some of that history, and then talk about the extraordinary things, the truly extraordinary things that are happening and have happened in British Columbia in the past decades and are happening right now, that are bringing change to people's lives here on World AIDS Day and really every day in BC. As you know, since 1992, when a British Columbian was dying from AIDS almost every day, the Centre for Excellence has been advocating for better evidence-based policies to inform the way we treat the disease in the province. Dr. Montagnier and his team created something that seems like it's been around for a while, but required extraordinary innovation here in BC, the treatment as prevention strategy, which has been subsequently adopted by jurisdictions around the world. The BC Centre for Excellence in HIV/AIDS also manages expanded coverage for programs that we've created just recently, including the program for pre-exposure prophylaxis, or PrEP, and the post-exposure prophylaxis, otherwise known as PEP programs. They work together with stakeholders, with people in the community, the health authorities, of course, non-governmental organization, and many, many individuals. This is our 32nd year, the 32nd year, commemorating World AIDS Day around the world. And we're commemorating it, of course, because we're commemorating that very history, that very struggle that I was talking about earlier, that has been so much the life of people fighting HIV and AIDS. And I think this is a moment on this day when we recognize the memory of many of those people, those who lost their lives from HIV/AIDS, those who've fought the battle for their friends, for their communities, for their neighborhoods, for their loved ones who've been living with HIV/AIDS. And today is both a reflection on what people have sacrificed and the cost, societal, the cost in terms of human beings of AIDS on World AIDS Day, and what we can do about it. So it's a day of reflection, and I think, given what we're achieving here in BC and the leadership of Dr. Montagnier and others, gives us significant reason to again recognize, as we did last year, I think on this day, hope as well. I want to say one of the things that we've done in BC is set the standard for the world. And this is something, the Centre for Excellence, which is not just a name, but really a value that BC has led on this issue of HIV/AIDS, and that Dr. Montagnier has led with his team and with many others. And I want to recognize the strength of our publicly funded healthcare system, which has provided many of the supports for people with HIV and AIDS with outstanding treatment and groundbreaking research. British Columbians across the province are wearing a red ribbon today, as you know, to commemorate and raise awareness, reflect and show solidarity with everyone affected by the disease. I'm proud to say that through the leadership here in British Columbia, again, Dr. Montagnier and others, we have done, I think, extraordinary things together. In particular, we created what was called the 90-90-90 target. And for those of you not familiar with what that is, which is a significant part of treatment for prevention, it calls for jurisdictions around the world to ensure that at least 90% of people living with HIV/AIDS are diagnosed, 90% of those diagnosed are receiving treatment with antiretroviral therapy, and at least 90% of those on treatment have a sustained undetectable HIV by 2020. Successful implementation of the 90-90-90 target is meant to lead to a 90% reduction in AIDS-related morbidity and premature death, as well as new HIV infections. The target was adopted under the direction and impetus of Canada, and of course, especially British Columbia in 2005, and has been renamed the UNAIDS 90-90-90 target. Today, we are pleased to announce that British Columbia has exceeded the UNAIDS 90-90-90 target. Exceeding this target is a giant step that our province has taken and confirms our unwavering commitment to moving towards an AIDS-free future. And we are already heading in the right direction. And as you may know, British Columbia, of course, experienced a spike in the incidence of new HIV infections in the 1980s and the 1990s. But as a result of our collective efforts, new HIV diagnosis have reached the lowest level now, down approximately 80% from the peak in 1987, when there were over 900 cases annually. Last year, we had already announced record low cases of AIDS in BC with 205 cases. What was once a devastating, life-threatening epidemic has now become a chronic, manageable condition. Today, we are excited to announce that the number is going down further, from 900 at its height to 205 last year, and if current trends continue, they suggest that new HIV infections in BC this year will be under 150, which is remarkable news. And news like this does not come around often in the world, and it shows how teamwork and collaboration is making a difference in solving the challenges that come along with HIV/AIDS. And it's that collaboration that is, I think, the strength of what we've created in BC, what health authorities have created, what Providence has created, what Dr. Montagnier has helped create, and all of his team and all of our partners in the community have helped create it. And there is more to say today. Last year, I believe on this day, we announced a new BC Center for Excellence fully renovated laboratory space at 647 Powell Street to complement the existing HIV molecular diagnostics lab at St. Paul's Hospital. Tests performed there provide guidance for physicians when choosing the optimal anti-HIV drug therapy for each individual patient. This precision medicine approach has been demonstrated to result in better treatment and better outcomes, and goes to show just a small amount of the innovation that our team at the BC Center for Excellence has put in place for people, regular people struggling and dealing with the consequences of a positive HIV diagnosis. And today we are officially announcing the opening of a new BC-CfE Center for Excellence walk-in clinic at 625 Powell Street, the Hope to Health Research and Innovation Clinic. Now, I say announce, and we do this, but we move quickly here, I think. Often in the Ministry of Health, we've tried to drive this. This is ordinarily something we would have announced, the opening of the Hope to Health Research and Innovation Clinic in March. Obviously, as a result of the pandemic, we just proceeded without the announcement, so we get to have the official announcement today, but people have been benefiting from the work of this clinic in the community for some time. It was established through the generosity of donors, but also, of course, with the support of the Ministry of Health directly, the Vancouver Coastal Health Authority, and Providence Healthcare. It serves people with opioid addictions, mental health and other health issues, including HIV and hepatitis C. And also supports people accessing medication for HIV and hepatitis C, as well as methadone and Suboxone for opioid addictions. There are other services, including referral for treatment, counseling, and other health services. We have a team-based approach as part of our team-based primary care approach in BC that includes doctors and nurses and social workers and peer support workers providing important care to patients. Currently, there are 10.5 full-time equivalent healthcare workers providing care to patients 8:30 to 4:30 Monday to Friday. And over 500 clients have registered in the clinic. People can walk into the clinic without an appointment to see a nurse or a social worker or a doctor as needed. I want to say on behalf of our province, with gratitude, my appreciations for the work done every day, everyone at the Hope to Health Clinic, by everyone at the BC Centre for Excellence for HIV/AIDS, for my friend Dr. Julio Montagnier and the whole team. And finally, I want to talk about, just briefly, about PrEP and PEP, which I mentioned earlier. We think that government has an important role to play. And that's why when I became Minister of Health, I directed the ministry to expand coverage for PrEP and PEP, and the extraordinary work in the negotiations and the organizing of this program that was put in place by Dr. Montagnier, by our team at BC Pharmacare and others, was truly something that I think was groundbreaking in the world and certainly in Canada. Many of you here know that PrEP helps prevent the transmission of HIV, and PEP can reduce the chances of acquiring HIV after any exposure. Since expanding coverage for people at higher risk of exposure to HIV in 2018, more than 6,000 people are now using PrEP. In addition, over 7,400 people are using the highly active antiretroviral therapy that has been free for all BC residents since 1996. I want to talk about, there are many other supports available that we could talk about, but what I think all of this evokes is the comprehensive response is the best response. There isn't just one answer. That treatment as prevention is important, but of course, so is other supports and primary care and housing and clinics in community and support for people and counseling and all of the other supports that come together to deal with a challenge as profoundly difficult and, of course, in our history, deadly as the HIV/AIDS phenomenon. And so I wanted to express my appreciation on this World AIDS Day to everyone involved, everyone who fought, everyone who advocated, everyone who changed public perception, frankly, about HIV/AIDS, changed the minds of people in leadership positions. And to celebrate, of course, because I think all British Columbians are justly proud of our Centre for Excellence, the BC Centre for Excellence for HIV/AIDS, and my friend, Dr. Julio Montagnier, and all of his team of people. And he will speak about them, but well, Dr. Montagnier is recognized justifiably as an international leader in the fight against HIV/AIDS. He has, working with him, a community and a team that is 100% all in all the time. And that is reflected in what we've talked about today, and it's reflected in what we need to continue to do as we seek to achieve a goal of ending HIV/AIDS as a phenomenon in our province. We are on the road to do that, and it shows what we can do when we work together. Thank you very much for having me, and thank you to everyone for recognizing December 1st, World AIDS Day. Back to you, Fiona.
Thank you so much for your kind words, and I, of course, absolutely endorse them, Minister, and would like to hand over now to Dr. Montagnier.
Thank you, Fiona, and thank you, Minister. As always, you are most kind, and I really appreciate your commitment, your support, and your enthusiasm, which is really palpable and makes our life so much easier. As you pointed out, we're today celebrating the 32nd World AIDS Day. It's been 4 decades now that we've been fighting this condition, and it shouldn't be lost to anybody's attention, the fact that what it was the #1 concern in the minds of many people of my generation has been left behind in some people's agenda because of multiple other challenges. I'd like to take this opportunity not to repeat everything that the minister said, which really reflects the outcomes and the success of our strategy over the last 3 to 4 decades, but also to bring to your attention the fact that people's focus has shifted, and with that we risk the potential compromising of the success of a strategy that is almost there, but never quite. The reality that we must grapple with is that fighting epidemics is a tough and fragile business. There is no such a thing as we are doing better. You are either winning all the way or at risk of losing all the way. And to make this a palpable example, I'll point to you the fact that in the month of April, during the lockdown, we saw the biggest single drop in the number of HIV tests conducted in the province by about a half. Fortunately, this was turned around very quickly in British Columbia, but not so much in other places around the country and the world. We are very seriously concerned that the inability to turn this phenomenon around is compromising the success of the strategy at the national, the continental, and at the global level. And as everybody now appreciates, there is no such a thing as an AIDS-free generation in BC if we don't have an AIDS-free generation across the board, because these pathogens don't respect borders, and they are very adaptable to move from one population to the other. So while I am incredibly proud and very much in support of everything that the minister said, I'd like to take this opportunity today to send a word of caution. We need to remain focused, and we cannot forget about the success that we have achieved to date fighting HIV, because there are other concomitant epidemics, whether it's the opioid epidemic, the COVID epidemic. They are all urgent, they are all important, but they cannot take precedence one over the other. Globally, the 90-90-90 strategy that was coming along reasonably well, at least in a number of countries, was badly derailed by COVID. I beg you, I call on your support to making it clear to the world that much more needs to be done, because it can be done and it should be done. On that note, let me move on briefly to the efforts in the downtown east side. I am incredibly grateful for the minister's support in our establishment of the facility I Hope to Health in the downtown east side. Last year, with the minister's support, we opened the molecular virology lab, which is tremendously useful to the work that we're doing down there and for the whole of the province. Since then, and again, thanks to the very incredible support of 2 particular donors in our community, we were able to secure the space at 625 Powell, adjacent to the laboratory at 647. And we now have been operating a research and innovation hub, the Hope to Health Clinic at 625 Powell for pretty much a year with tremendous success. In fact, we're currently seeing 738 individuals registered in the clinic. We have at least 400 recurrent clients, a significant number of them with opioid use disorders. In fact, we currently have 90% of the 100 patients who have a diagnosis of opioid use disorder in some form of substitution. This is a great opportunity for us to expand the work that we have done, in addition to the HIV and hepatitis C, which have been the focus of the center, rightly so, but to also encompass the other challenges that this population suffered, overlapping challenges, as I described earlier, not just addictions, but also COVID more recently. And there are a number of initiatives that we have deployed in collaboration with Vancouver Coastal and PHC, Providence Healthcare, to support the COVID effort. All in all, I want to leave you with a sense of gratitude on our part for all of the support that we have received that has made all of this success possible here, and in doing so, leading the world. Thank you, Minister. We would not be able to be here celebrating the success without your support. Thank you, Fiona. Thank you, PHC. And thank you, Vancouver Coastal, because you have been extremely generous on your support as well. Thanks.
Thank you so much, Dr. Montana. And we will now move on to questions. And I believe the first questioner is ready.
You hear me?
Yes, we can. Thank you.
Oh, great. Sorry, this is all new. Zoom, the mecca for awkward conversations. This question is for Dr. Montana, and I'm sorry if it's not going to sound very articulate, but looking at what you have gone through, the battle for HIV and AIDS over the last few decades, the challenge of getting people to change their behavior, and the challenge of stigma against people. And I know it's vastly different than COVID, but there are some similarities. And I'm wondering, from all your experiences, are there lessons that we can take from that epidemic to this pandemic?
Well, that's a subject for a whole different Zoom teleconference, let me tell you. I'll say simply yes. Every aspect of the work that we had done for HIV is directly relevant to the fight against COVID. Whether it is from early identification of cases through seeking individuals at risk, offering them testing, to management of those individuals in the most appropriate fashion. Of course, in the absence of treatment earlier on, with ensuring that the people would be isolating appropriately and so on and so forth, with the public health measures that were recommended, which have a lot of parallels to what we do. But there is a lot more that we could be doing and that we should be doing. And in fact, some of that is being currently explored, whether it's genetic monitoring of the epidemic or other strategic interventions to be able to move the needle forward. We are in constant contact with our colleagues at Vancouver Coastal, BC-CdC, and others, exchanging ideas and thoughts in terms of how to move these issues forward. It's challenging, but I think we're making progress. And while it's not as fast as we all desire, there is a light at the end of the tunnel, and it's getting brighter by the minute. The vaccine's around the corner, and we are extremely confident that towards the end of 2021, we will be looking at a very different future.
And I just add, Lisa, in response, this is Adrian Dix, that I think what's important and what has been important is the role of the BC Center for Excellence here. In the last number of years, there's been significantly less attention to HIV/AIDS than there has been in the past. And we recognize that partly because, of course, of the very success we've talked about. But some of the major innovations that have taken place, in particular, I think BC's lead role, I would argue, in the world in access to PrEP and PEP. And one day I will ask Dr. Montagnier to give another briefing about what the difference that program has made to outcomes, which is breathtaking. And it was not an expensive program in relative terms and cost of healthcare. But I think what it shows is when you're dealing with something as challenging and problematic as HIV/AIDS, that there are all kinds of other consequences to the actions we take. And that's why the response has to be broad, and why I like a team-based clinic that is being led by Dr. Montagnier and his team, because I think that's important. And at the same time, we have to keep pushing. We have to continue to be leaders, and because going from 208 people to under 150 people is an extraordinary success. But each one of those are people's lives, and this is a profound change and success in the life of really thousands of British Columbians. And this is because, in spite of the fact that there hasn't been the same attention, we have continued to drive on this issue. And that's, I think, part of why the Center for Excellence model that Dr. Montagnier has led is so important.
I don't know if I can get a follow-up here.
Sure.
And I didn't point out, sorry, that I'm with News 1130. I was supposed to announce, so I was with Lisa Usda with News 1130. Dr. Montana, so taking from what you've learned and the successes that have been had, you know, one of the big challenges right now is asking people to change their behavior. And of course, putting on a mask is vastly different than asking someone to put on a condom, but sort of the same. And I've seen some really good memes done about that. So what are some of the challenges? And I don't know how they can counteract getting this message out to people of the, you know, this relatively simple changes that are, you know, uncomfortable and annoying and different, but relatively simple changes to protect people, and how that message gets out there.
You know, these are difficult issues, and education is the answer. Beyond that, leadership. We need to send a consistent message to our leaders that there are certain steps that we should all be taking, and that will be redundant in benefit. It doesn't help when prominent individuals around the world, and I won't name names, but there is one down south very close to us, go around challenging the role of masks, for example. That creates a huge problem. I don't envy Tony Fauci for a minute. He's a personal friend and a mentor. He has had a very difficult time in this regard, and this has created problems to all of us. Now, I'm happy that Scott Atlas has resigned as of today, and hopefully that means that south of the border we will have a more consistent and favorable message. But we should not politicize public health measures. There is the right thing to do and there is the wrong thing to do. And if we all send the same message and provide the leadership, then the wearing of a mask when we are in public environments will become the new norm.
Thank you very much.
Thank you so much. I'm really sorry that we're now out of time, but I just wanted to say thank you so much for everyone for joining us on this really important day to help tell the HIV/AIDS story. Thank you very much.
Thank you.
Thank you, Minister.
Thank you. Thank you.